Dear all, welcome to this video. Please hit the subscribe button so that you automatically get updates for upcoming videos and lectures. Thank you. Enjoy watching.
Before we go for the actual topic virulence, we will just see the ratio of the microbes and humans available in world. Okay, so microbes can be classified into pathogenic, non-pathogenic. Pathogenic are the microbes which cause harm to the host cell. It may be humans, it may be animals, it may be plants, anything. So the number of pathogenic microbes is quite less. Here, as you can see, it is a peak or a pyramid shaped microbes distribution where the peak contains the pathogenic number of microbes. Then the middle portion are many microbes are potentially pathogenic, means it is a combination of both. They are pathogenic but they do not cause very severe diseases, means though they cause some diseases but they are treatable, like the diseases which are causing cough and cold. So those are included in the middle one. And the last one, that is the base of the pyramid, it usually contains pathogens, it usually contains microbes which are very less pathogenic or neither not pathogenic at all. That is all the natural flora which is present on even human skin or in human intestine, like E. coli and all. So those bacteria or those particular microbes come under the class of non-pathogenic, and they form the max. First is infection. What is infection is once a particular microbe enters into your body, once it invades your body. The word invades here means entering inside a body. So invasion of the body by a particular pathogenic microbe is called as infection, whereas the term disease, it indicates that that particular infection has been converted into signs and symptoms shown by the host. Okay, so say for example the current situation where we see that there are two type of corona patients. That is, one is symptomatic and the other is asymptomatic. The asymptomatic carriers are those which are not showing any interactions, but they are still carrying that particular microbe. So that particular patient will be called as the infected patient, but he is not having the COVID-19 disease. That particular infection has not been converted into disease. Okay. Whereas a particular patient who is showing symptoms, so that particular patient is suffering from the disease. Next is parasites. Parasites are the microbes which cause damage to the host cell. So whatever we are discussing, that the pathogenic microbes, so those pathogenic microbes are called as parasites. Next is commensalism. Commensalism is a term where the microbes and the host, they live in relationship where both are benefited or one is benefited. Like in commensalism, one is benefited, the other remains unaffected. Whereas in symbiotic, both are benefited. Means the microbe-host relationship is such that both are benefited. Next is the host-parasite relationship. Now, in this host-parasite relationship, we have to maintain the balance of parasite virulence and the host resistance. So, here you can see, as I discussed, what is parasite virulence. The term virulence can be defined as the strength of the microbes. How virulent a particular strain of a microbe is will define the resulting disease. If a particular microbe is very virulent, it means that a particular microbe is capable of causing a severe disease. Okay, so that is the parasite virulence, and in the next column here you can see that it is a host resistance. Host resistance is the immune system of a particular host. So here we have to maintain the balance of this parasite virulence and host resistance in order to be the host in healthy condition. Like here if you can see that the virulence of the particular parasite is high. Okay, here you can see if it increases, then it may lead to a disease. If it decreases, then the particular individual remain healthy. Complete opposite is in case of host resistance. If it increases, then a particular individual will remain healthy. If it decreases, then it may cause disease. Now here are the terms related to different types of infection. First is the primary infection. Primary infection is the infection where a particular person has been first time exposed to that particular pathogen, and that pathogen has caused a disease in that particular patient. So that is a primary infection. Secondary infection is particular patient is undergoing some treatment and he has been infected with some other infection, and during that period or during the treatment or after the treatment he has been infected with the second microbe or second type of pathogen. Reinfection is the particular patient is again reactive, means he was infected, he was having the particular disease. After a certain period of time, he got cured from that particular disease, and later on, after a certain period of time, again he got infected with the same microbe. So that is reinfection. Cross infection is where a particular patient is already suffering from a disease, and during that particular period he has been affected with some other disease also. Say for example, a particular patient is infected with HIV, and during that period only he got infected with TB, because your immune system is very low in that case, so you get infected with many kind of diseases. So that is a cross infection. Nosocomial, which is also known as hospital induced, that where you are going into the hospital and getting infected due to unhygienic conditions if the hospital doesn't maintain. Next is heterogenic or physician induced, where the particular physician is suffering from a particular disease and you are getting treated from that particular physician, and that is being transferred to you. Focal and local infection is one and the same. It is limited to a particular part or area of the body. Like in case of focal, you can see it is limited to particular organs like tonsillitis, or you can say hernia. So these only that particular region is getting infected. So that is focal. But why these two terms have been different? Because focal is related to only a particular organ, whereas local is related to particular site. Okay, so now local infection will include boils, pimples, bumps, so all those that. Subclinical are the infections which do not show symptoms. Okay, the particular patient has been infected with a disease, but there are no symptoms. Systemic is the whole body is infected because it is in your bloodstream. Mixed is you are getting infected with two or more microbes at the same time. So that is mixed. Acute is you are getting infected with the microbe, and you are being cured early within 1 or 2 weeks. You get easily cured, so that is acute infection. Chronic is example is TB, where you have to take the treatment for a long period of time, like for 6 months or 1 year. So that is a chronic infection. Fulminating is a infection where you get infected and within 2 to 3 days the severity increases all of a sudden. Means the gradual increase in disease doesn't take place. Suddenly the disease increases. So that is fulminating. Pyrogenic is the one which causes fever. The infections which cause fever, that is pyrogenic. Latent is the infection which gradually grows. Okay, means initially you have got infected, but after a very long period of time, symptoms have been shown. So that is latent. Now again, the diseases have been classified into different terms, that is endemic, sporadic, epidemic, pandemic. Endemic is a disease which is very common in a particular area. Okay, so example is typhoid fever in India. Typhoid in India is very common. So that particular type of disease is known as endemic disease. Sporadic is a disease which is not common in a particular region. Like in US, the hygiene conditions are so up the bar that they usually do not show the symptoms, or they usually do not get infected with more commonly with these kind of diseases. So typhoid fever in US becomes a sporadic one. Next is epidemic. Epidemic is, as you all know, it is limited to a particular area or a city. So you can say that a influenza epidemic, or you can say cholera epidemic. So many people are being infected with the same disease at a time. Pandemic, very well example is corona. So initially it was plague and all. Communicable diseases which get transferred from one patient to another, so that is communicable. Non-communicable which do not get transferred from one person to another. Example is tetanus. Now, what are the sources of infections? Usually human beings, because man or human being is full of microbes. So human beings, animals, even animals carry microbes, insects usually like mosquitoes and all, or cockroaches. So those are sources of infection. Environment it includes air, water. So all those things are also full of microbes. Now, what are the methods of transmission of infection? So usually contact, that is one-to-one, person-to-person contact. Okay, so that may lead to infection. In case you are suffering from pulmonary disease by sneezing, coughing, so you can spill out the sputum on some other person by mistake, and it may lead to disease. Next is vehicle. Vehicle here, it means some diseases are waterborne, some diseases are airborne. So that here air, water, they act as a vehicle and they transfer the disease from one person to another. Vector here it means diseases like malaria, dengue, where the parasite it resides on that particular mosquito, that is Anopheles mosquito, and then it gets transmitted from one person to another.